When it's time for a road trip, you never want to leave your best friend behind, but what if your pet isn't excited about going and it's not even from your driving? The Hemp House has a variety of products for dogs as well. Visit hemphousechat.com for more information.
Welcome back to 3+U. This is September Prostate Cancer Awareness Month, and I am in my early 50s, so yeah, that is of heightened concern to me and lots of men around the country. Let's bring in Dr. Jeff Mullins. He is a urologist for CHI Memorial Urology Associates. And Dr. Mullins, thank you for joining us, first of all. And this is something that I think people are aware of, but they still never do anything about it. So let's start with just the prostate in general. What is it? What does it do?
So the prostate is a male reproductive organ, and it has roles in basically helping with fertility when we're younger. As we get older, it basically gets enlarged, causes obstruction, and gets cancer. So nothing really good when we get over 50.
Is there anything that people can do when they're younger, vitamins they can take, things that will help keep the prostate from enlarging?
So prostate enlargement, prostate cancer are different processes, and there's no good randomized data to tell us what we should do to keep a healthy prostate. But what I tell all my patients is to live a healthy lifestyle. That means exercise, eating an anti-inflammatory diet, high in fruits and vegetables and lean meats, avoiding processed foods. If you can reduce your total body inflammation, I think you reduce your risk of lots of different problems, including prostate enlargement, prostate cancer. And if you do get these diseases, then you're fitter and better equipped to deal with them.
And I like the way you said that, doctor, because that's one thing that I had been told before. I had always associated an enlarged prostate with higher risk of prostate cancer, but the two are separate. So if you're taking, I don't know, whatever, fish oil or whatever it is, so that your prostate is going to be smaller, that okay, maybe you won't have to pee in the middle of the night, but it doesn't mean you're reducing your risk for cancer. And you're saying that, and I assume this is the process with all cancers, just a healthy lifestyle, equipping your body to be able to fight off anything, cancers or anything that does attack your body is kind of the key, right?
Yeah, that's right. I mean, we only have so much control over what happens to us and the exposures we're exposed to in our lifetime. And so you take control of the things you can control, your exercise, your diet, and those usually pay off dividends in the end with either not getting the disease of interest or being better able to fight it if you were to get it.
And part of that taking care of yourself, of course, is getting screened and checked out. It's called a PSA screening. Tell me what that's like, and when do men need to start getting those screenings?
So PSA stands for prostate-specific antigen. It's a protein in our blood, and it's how we screen for prostate cancer. The reason you have to screen for prostate cancer is the majority of cases are asymptomatic or don't cause symptoms. So prostate cancer typically does not cause blood in the urine, doesn't typically cause going at night or a weak stream, and so we have to look for it. And there's been lots of different guidelines that have come out for PSA screening. But for the average risk man, I think a PSA every year or two, starting around age 50, is a big general recommendation.
And I think one reason that a lot of men don't do it is because if they've never had any kind of an invasive colonoscopy or anything like that, I'm not getting that done. I'm not worried about it. My understanding is that the old-fashioned way it's still done, but isn't there also a blood test, something like that can be done as well?
Yeah, so PSA is a blood test, and so there's not an invasive test. And PSA screening in 2020 is much more precise, much more accurate, a lot less invasive than it's really ever been. And so having a blood test and a conversation, I think, is a pretty easy way to keep yourself safe.
And I'm looking directly on my notes, and as part of what you just said, it has the words fusion biopsy. Explain what that is.
Right. So the problem with PSA is if we biopsy every guy who has an elevated PSA, we'll have lots of negative biopsies and lots of people who have cancer that's not really that important. So PSA has a lot of false positives. So what we typically do with an elevated PSA is get an MRI. if an MRI shows a lesion that's suspicious in the prostate, we can target that spot using an ultrasound and some computer technology. And this minimizes the number of biopsies people need. It makes biopsies much more accurate. And additionally, I can also put the needles through the skin now, so your risk of infection and having complications is also way, way less.
Yeah, you're talking about improvements in surgery, improvements in the safety of radiation if there is prostate cancer. A lot of times, is prostate cancer still considered, and I'm using our term, but a death sentence, or are our recovery rates starting to improve?
No, it's certainly not a death sentence. In fact, a lot of prostate cancers don't need to be treated, and we're looking for the ones that do. And if you have a cancer that needs to be treated, we have so many treatment options. The safety of surgery, the safety of radiation is better than it's ever been. People can be cured and regain total functionality. And even if you have advanced prostate cancer, the number of treatment options has exploded over the past 5 years. And so using the urologist, the radiation oncologist, the medical oncologist, we're able to give people either a cure or years and years and years of normal lifestyle.
And we only have about 15 seconds to answer this, doctor, but real quick, having the prostate removed, not an option. I mean, that's other than you'll never be able to have sex again. I mean, is there any other downside to having it removed if you are discovered that you have prostate cancer?
So the good news about surgery is actually we're able to minimize the risk of incontinence and erectile dysfunction now. And so with improved techniques, a lot of my patients actually have totally normal sexual function and urinary function. So I think treatments are very, very good now.
Awesome, doctor. Thank you so much. Dr. Mullins, we're back after this.
Riverfront Medicine DPC provides timely access to your doctor, low-cost screenings and prescriptions, injury care, even the latest cosmetic treatments. Get better health care at a lower cost for your entire family. Riverfront Medicine DPC, a better health care